as medical directors, when we look at an ultrasound in order to make sure that everything looks fine, the first thing that we do is make sure that the patient identifiers are correct. Next, make sure that the dating is correct in terms that the scan was done most recently and it wasn't done in the past. And then we look at all of the images. And what we do is that we're looking, number one, to make sure it's not something called an ectopic pregnancy or a pregnancy that is not in the uterus. So we review all of the images and make sure that it's not an ectopic pregnancy. Once that we are able to establish that it is not an ectopic pregnancy, then the next thing that we look for is if there is fetal viability. And what that is, that's just a fancy way of making sure that the pregnancy has a heartbeat and that it is a viable, normal pregnancy. Many times women will see us and it's a very early pregnancy, so we aren't able to 100% establish that it is not an ectopic pregnancy or that it is a viable pregnancy. And that's common, that's normal. You'll get that at any sort of ultrasound that you get done very early in pregnancy. And as long as there aren't any risk factors in the patient's history or the patients aren't having any bleeding, pain, cramping, anything like that, we usually will see them back in a week or two for follow-up ultrasound just to make sure that things are progressing in the way that they should. Once a pregnancy is established to be in the uterus and viable, then we will set them up with OB providers in the area so that way they can establish prenatal care as soon as possible.